All right. Well, today we are talking about Chapter 7, which talking about the health of the elderly population in the United States. It is good to realize that we are talking about population groups around age in this section of the book. We talked about mothers who are pregnant and their children in 2 chapters ago. Last chapter, we talked about young adults, adolescents, and adults. And this chapter, we are talking about elderly, which is those individuals who are 65 and older. And there are an increasing number of these people in the United States. To give you a frame of reference, in 1950, 8 out of 100 people were 65 and older. And so this, in a sense, makes an elderly person sort of a rarity, or they're not as common. In 2008, it's 13 out of 100. And looking into the future to 2030, 20%, that's 20 out of 100 of people, will be 65 or older. So the percentage is really growing. And it's not just growing like this in the United States, but around the rich world, it is growing. And this is largely due to the fact that we have more nutrition, that our medicine has improved dramatically, that we understand how to stay healthy. They divide up our elderly years into 3 sections. The young old are those individuals who are 65 to 74. So these are the people who are just kind of coming into their elderly years. Many of them are still going to be working. They probably have more energy, less chronic illness. The middle old are those who are 75 to 84. More people dying in this age group than the previous one, more chronic illness, more debility. But some of them may still be working, probably not that many, but more of them are maybe moving to nursing homes. More of them are thinking about alternative living situations. And again, more illness and debility during this time period. And then the old, which are the 85 plus. Now, most people don't make it to this last age group. If they do, there's a much higher percentage of them that are going into be in places where, like nursing homes, which is an old term. Nowadays they use, I think it's assisted nursing facility is the term for that. And more frailty, more higher mortality rate in this last group. So, with so many elderly people in the United States as a percentage anyway, there is the issue of dependency ratio, which means that how many people are going to be working versus how many people are going to be living without working. And so if you think about age groups that don't work but still need housing and food and medical care and transportation and et cetera, then versus those people who are working, who are providing the medical care and the food and the housing and the transportation. And so at some point, you're going to have too many people who are not working, needing too few people who are working. So this is the idea of the dependency ratio, sort of the young and the old who are not working versus the people who are working. And so this could be a concern in the future, but maybe not, because some people are saying that maybe robots will be able to care for us and drive us around and feed us and things of that nature. So that's a kind of an unknown, but it is something that as a nation we should be at least thinking about. So let's look at demographics of the elderly. Looking specifically at men, the vast majority of elderly men are married, 75%. A lot less of them who are female are married. So about half of women are married. But this is changing as the baby boomers, the group of people who were born right after World War II, are kind of coming into their elderly years. Many more of them are divorced compared to the generation before them. Men are living about 5 less years than women are, and so that explains one of the reasons anyway, why women are much less likely to be married than men. Only about 5% of elderly persons are living in nursing homes. That means that 95% of the elderly are not not living in nursing homes. Many elderly people and adults and young adults are worried that when they're older they're going to live in a nursing home, but the odds are actually against it if you're that an elderly person would be living in a nursing home. A nursing home is really just it's a medical facilities, which means you need to have a medical problem. Nursing homes were originally created as an alternative to a hospital. The hospitals were getting overcrowded and expensive, and so they created nursing homes as ways of taking people who were going to be in hospital-like care for long term, and so they had a place to put them that was not in the hospital. The older group, today's elderly, are more white than the elderly people that are part of I'll talk about the terms we just learned. The old, or the oldest old, what was the term for that? Old. The old are whiter than the young old. And some of the people who will be elderly in 10 years, many more of them are people of color. The Midwest, which is where we find ourselves in the United States, we are fairly small as a percentage of the population in the United States. However, we have a lot of elderly people here as a percentage. So that may impact us as well, because elderly people are going to be using more healthcare resources, and many of them are not working, and so that just changes some of the dynamics of living in the Midwest. So, in terms of poverty, elderly people are doing much better than they used to do. In 1970, 25%, which is 1 out of every 4 elderly persons, was in poverty. That's actually a really high rate. Today, it's around 10%. And so the elderly are doing better. They're not as poor as they used to be in the past. If you look at where their money comes from, the largest contributor of the elderly person's incomes comes from Social Security. Social Security is a federal program where working people put money into the fund, and then when they are elderly or disabled, they pull money out of that. Now, when this program was first created, people weren't even living long enough to withdraw from it. Most people were dying before they even hit 60, which is when people are pulling money out. And so the program did fairly well. Today, people are living much longer. Most people are actually getting a Social Security check before they die. And so the program is in much more trouble. In fact, a few years ago, the tide turned on Social Security, where now more people are pulling money out of Social Security than more money is being taken out of Social Security than the money that's being put into Social Security. So you can only do that for so long. If you have a bank account, let's say, and you're taking more money out than you're putting in, eventually that bank account is going to default, bounce. Social Security is not the only source of income for elderly people. Some people have pensions. A pension was kind of an old retirement system that was created when companies were around for a long time and big and had workers that would work for them for decades at a time. And the person would retire and they would get a check from the company for every month after they worked there. And as long as the people didn't live too long and didn't require too many pension checks, it was fine. But people are living a lot longer. People also aren't staying at their companies for decades like they used to. Companies are also, not holding on to their workers as long. And so we've largely switched away from a pension-style program, although some places still have it, such as education still has it. But many people are, saving for their own retirement. In fact, if you're not saving for your own retirement and you are working, boy, I would say you should start opening up a retirement account today. And if you want some advice on that or some direction, shoot me an email and I'll see if I can't help you out. So, all right. In terms of the health profile of elderly today, the Good news is that elderly people are healthier today than they were in the past. They're living longer, they have better functioning than they did in the past. The number of chronically disabled older people is down as a percentage. But as we get older, our health tends to go downhill. It's not a guarantee, by the way. Just because somebody's old doesn't mean that their health is suffering necessarily, but there are biological changes that happen to our body that result in more health problems, such as that our skin changes. So we're going to have more trouble regulating our body temperature. We lose that layer of fat, and that's what keeps us warm in the winter. And we lose the ability to sweat, and that's what keeps us cool in the summer. We lose, the gums around our teeth begin to recede. Our brain shrinks. There's just a lot of different things that happen in our body that can lead to more health problems. And these are sort of, I don't know if natural is the right word, but that's what I want to say. These are natural changes that happen. And so it shouldn't, people can be very healthy as elderly people, but it is more and more difficult. I'll just say it like that, right? The top five causes of death for the elderly in the United States has traditionally been heart disease, cancer, stroke, and lower respiratory disease. Much of that is due to smoking, and then Alzheimer's. Alzheimer's disease is a form of dementia, which is a memory issue, and sometimes, eventually, the body forgets how to have the heartbeat and the organs function and things like that. The only thing that's different from the traditional causes of death is COVID-19, which in 2020 was the third or fourth largest contributor to death in the United States. And elderly people are more vulnerable to this than people who are young. 1/3 of elderly people have chronic conditions that limit some sort of functioning. For men, these can be life-threatening. In terms of impairments for elderly people, the impairments are often sensory, not always, like memory is not a sensory, but sensory such as vision, hearing, balance. One out of every 6 elderly persons has some sort of visual impairment. 1 out of every 4 elderly person has a loss of feeling in their feet. And this is significant because if you have a loss of feeling in your feet, you may not be able to drive as well. You may not be able to walk or run as well. And then 3/4 of them have some sort of balance impairment. In terms of health behaviors, elderly persons actually do less of the things that are really harmful for us than the general population, such as smoking. A lot less elderly people smoke than the adult population. A lot less elderly people drink to excess than the general population. A lot less elderly people are overweight or obese. Now, is this because the elderly people that would have done that have already died and they just didn't make it to their elderly years, and that's why there's less of them? Or is it the elderly people, once they hit 60 and they decide to change their behavior? For instance, in men, maybe the same things that cause them to drink heavily was their amount of testosterone, which in older men drops off as they get older. And so they let some of those behaviors that were bad for them go during this time period. So, in terms of health behaviors that are going to benefit them the most, that's eating. Nutrition is very important, and not just eating whatever is convenient or tasty, but nutritional things that are going to include proteins and vitamins and minerals and vegetables. Exercise, especially in the elderly years, people lose muscle mass, very common. And if you're going to keep your muscle mass, you need to be intentional about exercising the muscles and being immunized. Most diseases are like animal predators. They prey on the weak in the herd. If you have a herd of elephants or a herd of bison, which are the ones that are going to be eaten by the wolves or by the leopards? It's the young and the old. Those are the ones that are most vulnerable. So that's why getting immunized, getting getting your vitamins, getting your fibers, the things that are most important to keeping one healthy and strong is most important with this. However, inactivity, and so while it's important that elderly persons exercise, inactivity tends to increase with age. If you look at a 5-year-old and how much activity they do, and then you look at a 60-year-old and how much activity they do, and then you look at a 90-year-old, you're going to see a pretty clear trend. The 5-year-old's pretty active. The 60-year-old, less so, but hopefully still the 90-year-old, a lot less so. And that's just, maybe that's just a natural thing that we slow down with age. In fact, only about 20% of the elderly population engages in regular leisure time physical activity. So it's important to be conscious of that trend to actively work against it. Make sure you continue to remain active, or the person that you're working with continues to remain active in their elderly years. My father used to always say that when elderly people, when they remain active, they keep it. They're able to continue doing, maybe they chop wood, for their fireplace. As long as they keep doing that and they don't stop, they'll probably be able to keep doing it. But if they were to stop, and let 12 months go by without doing any of that, then they may not be able to go back to it. Let's talk about Social Security once more. The average Social Security check is $1,400. At least that's what it was in 2021. The majority of people receive more than half of their income from Social Security. Americans in general are not ready for retirement. They're not ready to stop working. They haven't saved enough. They are unaware of what it actually costs them to live, especially live as an elderly person, when things like healthcare, especially pharmaceutical drugs, are really expensive. And Social Security is sort of the safety net that is there to keep people from falling into abject poverty. But it was only intended to be a supplement. But for most people, it's the largest part of their retirement savings. And so if you are working with somebody who's in their 40s and 50s and they've only got, $50,000 saved for retirement, you need to light a fire underneath their butt, because they're in for a shock. Because what if that person retires at 70 years old and they live to be 90 years old? They've got to live on that money that they've set aside plus Social Security for 20 years. And maybe they're planning on working, but it's difficult for people who are 80 years old to have a job that pays enough money for them to even really make it worth it for them to arrange for transportation and uniforms and the things that are required to go to work. So, and to top all that off, to add a little bit of misery to the mix, Social Security is expected to run out in about 2034, I believe. So hopefully it doesn't. Hopefully politicians decide that it's worth saving and that they kind of come up with some sort of cure to the problem, but that is not necessarily guaranteed. Let's talk about housing. Many people would prefer to remain in their house that they lived in before they were elderly. Maybe they raised kids, or they, bought this house when they were in their 30s and now they're in their 70s, and they just have all these memories and this meaning of living in the neighborhood and maybe hosting grandchildren when they come for visits on Easter. But that house may not be set up for elderly people to live in. It may have stairs that lead up to the bedrooms. And if a person is elderly, and maybe they can do it when they're 70, but maybe they're not able to do it when they're 80. And so that might require chair lifts for stairs. It might require handrails in bathrooms. It may require live-in help. It may be just too big for the elderly person to live in, and they have to come up with an alternative solution. Maybe there's a ranch-style house down the street that they could move to, so they get to remain in that same neighborhood, but don't have to worry about a big, giant house with a couple stairs. So Moving tends to have a negative effect on the elderly people for all the reasons that I just mentioned, but it may not be avoidable. It may be a requirement. So it's a tough conversation to have with an elderly person in terms of what do you do for their housing, right? So many elderly people want to live in, well, first of all, they want to live in their own home, but if that's not possible, they want to live in, oh, what are these called? They want to live in assisted living facilities. Elderly people want to live in these dormitory style housing, almost like apartment style housing for elderly people. And we've got lots of assisted living facilities here in Southern Illinois. There's one in Ulin, there's at least one in Anna. The idea of these is sort of like a dormitory for elderly people. Dormitories in college, they provide your meals, there's a place to do laundry. The difference here is that there's actually a kitchenette in each individual room, so the elderly person could cook for themselves if they want to. They can do their own laundry, but the cool thing is they don't have to do it. And that allows people who are higher functioning to live in the assisted living facility. So they're doing their own laundry, they're taking care of their own medication, they're cooking their own meals, they could drive, But then if later on they lose their ability to cook or take their own medication on time, the facility is there that's able to do all of those things for them. That's the idea of aging in place. You're in a place where if you're high functioning, it's not restrictive, you can be there comfortably, but then if you lose those abilities, you can still remain there without having to go somewhere else. But this is hard because a lot of elderly people want to remain at home until the very last second. And that very last second might be when they have overwhelming medical problems and they may need lots and lots of care. And if a person needs lots and lots of care, the assisted living facilities may say, you know what, you're not really appropriate for us, which means that they may only have the nursing home as an option, which is what they were trying to avoid to begin with. So it may be that the elderly person needs to not wait until they lose lots of functioning. They may need to transition to the living facility to be there before they lose their major functioning. And the assisted living facility is going to be less likely to kick somebody out who's already been there while they were healthy. Talking about health care. Elderly people are heavy users of health care. They have longer hospitalizations, they're hospitalized more often, and while elderly people only make up about 13% of the population as of, it's like 2020, they use 37% of all the healthcare. So they're using a large portion of it, and they spend a lot more money on prescription drugs. And even if you just look at all of the elderly people and all the money that's spent, it's those last few years when the most money is spent. And so it's those last few years. And this is an interesting issue because some people say that we are thinking about healthcare wrong, and that healthcare is not meant to just keep us alive for as long as possible. That healthcare is there to improve the quality of our life. And if we could just learn to say no to the next procedure, the next treatment, we as a society, we would save a ton of money, but we also wouldn't lose very much in terms of quality of life. But this is hard because what if it's your grandmother and, it's your grandmother and she's got multiple problems, but the doctor says, hey, I can do this operation and it's going to be, 50% likely that it will be successful, but she will have to use a walker likely for, the rest of her life. How do you feel about that? Well, we're programmed to say, yes, do it, of course. I don't want to lose my grandmother. I want her to live as long as she possibly can. And it's like, okay, but then you're then having to wait for the next thing to pop up that causes grandma to die. And it's just very difficult for us to know when to say enough is enough. Public money pays for the majority of the expenses for elderly. Medicare is the federal program. It is nearly universal for elderly persons. Nearly every elderly person in the United States, when they turn 65, is eligible for this, I guess, socialized health care. And it covers much of what elderly people are going to need, but there's multiple parts to it. You might have heard of Medicare Part A, Part B, Part C, Part D. And depending on whether the elderly person signs up for these extra components, kind of determines what services the program pays for. In 2020, there were 62 million beneficiaries of Medicare, and this was expensive. It was $776 billion, which is really a big number, and it's hard for me to think about that. But this is a little bit easier for me to understand. It's 12% of the total federal government spending. So if all the government spending can be reduced to just $100, 12 of those dollars go to spend on Medicare. So it's a large number of elderly people that are on this program, and the government's spending a lot of money on it. In addition to Medicare, about 7 million elderly people are on Medicaid, and Medicaid is the federal health care program that is mostly composed of poor people. And the reason why this program is a little bit better for people who are elderly, and in general, it tends to be it covers more treatment, such as nursing home stays and long-term nursing home stays and home health care, as well as prescriptions. But you have to be poor in order to receive this. And so sometimes when elderly people need to go to a nursing home, they are made to be poor. The cost of health care for elderly people is increasing, as it's increasing for all age groups, but it's probably especially here because elderly people are making up an increasing number of the population, and they use a lot of health care. It's important to remember that the goal of working with the elderly is to keep them healthy. And how do you keep somebody healthy when they're elderly? Well, again, one of the pitfalls is to have them become isolated and undernourished, and so transportation is a barrier for many people who are elderly. Lives 10 years after they give up driving. So we can expect for elderly people to give up driving 10 years before they die. And so what is the big deal with this? In addition to the fact that transportation often brings them to social events, transportation is really important in many places in the American society. The only exception I can think of where it would not be important is if everything was where the person was living, meaning their food was in that location, their family, their friends were in that location, their recreation, their medicine is in that location. And there are places like this, for instance, assisted living facilities, nursing homes, and then even some families have the person living with them, and assuming that family can provide those things, then transportation potentially may not be needed. But for the average elderly person, though that is not their situation, they oftentimes give up driving because of the cost of driving, which is expensive, that we actually as Americans tend to underemphasize. We actually tend to think that driving is much cheaper than it actually is for us. But if they give it up due to the cost and then also due to the ability, for instance, they lose their ability to see well enough to drive, or their hand-eye coordination, or they lose feeling in their feet, so they are not able to control the gas and brake pedals effectively, then they don't just lose their friendship connections and their ability to go to doctor's appointments and the grocery stores and church, but they also lose an identity. If you think about what it might felt like when you turned 16 and you got a driver's license, and now you're able to hit the road and be an independent person. Well, if you then lose that, then you're sort of losing this identity as somebody who can take care of themselves, who can go where they want when they want to. So that is oftentimes a difficult thing for an elderly person to lose. So this is why public transportation or transportation systems where other people are able to pick them up and drive them places, even if it's things that are maybe seemingly not worth the drive. For instance, some elderly people will just go to the dollar store and spend an hour and a half kind of just wandering through the aisles. And for them, that's really meaningful. And you might say, well, do they really need to be driven to that? I mean, they don't really even accomplish that much. But for them, that's really meaningful. And it's a way of socializing. They're out, they're doing something, they're looking at interesting things on the shelves. And if you don't have the transportation, then the person isn't able to get out of their home and do those meaningful things that make life enriching, make life meaningful, and then ultimately make us live longer. When people don't have that, they may not live as long. So, meal services. Sometimes elderly people they find that they don't want to cook for themselves. They lose motivation for cooking, and they may eat things that are less nutritious than they ought to be eating. Federal and state budgets provide meal services such as Meals on Wheels, which is a home delivery service. They do it about 5 days a week, and it is delivered by volunteers. There are also congregate meal programs, which are oftentimes around the noon meal, and they're in central locations, and it's a way of people getting together and not only getting nutrition, but also feeling like they're in the midst of community. Some people are not able to leave the home, though. And for those people who aren't able to leave the home, and while I might argue that that's probably the best if they are able to, but what if they're not able to leave the home due to medical reasons? Well, then there are visitor programs where visitors will go to the home of the elderly person just to visit with them, maybe not even to provide any sort of service outside of just socialization. This often can be very meaningful for that person and almost on the same level as medicine. When I was young, I never planned on having money. I thought I would kind of like never make more than $30,000 a year. I didn't know that much about money back then. Maybe I still don't know that much about it now, but I do know that money impacts the way people live from the time that they're born until potentially the time that they die, maybe even afterward, as the funerals of the rich are a lot more extravagant than the funerals of the poor. Our book says that people's education, their income, and their job are the single most influential contributor to whether they have premature morbidity, which is disease and disorder, and mortality. So it's actually like the best predictor of whether somebody will have a disease or whether they will die early, which is this is how much money they have, but also their education and their job, which if you combine those three together, that's what we call socioeconomic status. And so it seems that money really makes a big difference in addition to what you know and what kind of job you do. But on the other hand, poverty has the opposite effect. Poverty makes it more likely that we will have a premature disease, that we will have a premature disability, and that we will die ultimately earlier than our rich counterparts. And so what's the relationship there? Because that doesn't seem very fair. I mean, not everybody gets to choose how much money they make. It turns out that the more education, we'll start with that one, the more education somebody has, the better they are able to navigate the healthcare system, the better they are able to make healthy decisions for themselves. Also, the better educated they are, the more likely they are to get a job that provides things like healthcare insurance, health insurance, and they are more likely to work a job that is healthy, work a job that they enjoy doing, work a job with people who enjoy doing their job, which means that it's more likely that people on the job are going to be in better spirits, have a better view of the world, less likely to do things to counteract the, say, misery of working in that job, such as drinking heavily or using drugs. When people have more income, they are able to go to the doctor. They're able to live in safer, healthier neighborhoods. They are able to go to the grocery store and buy more fresh fruits and vegetables, which their poor counterparts may not be able to do. The neighborhoods that they live in are more likely to have better parks and more recreational activities in those neighborhoods. It seems as though higher income equals better health, as if we needed another reason why we should be richer. So, all right, well, how do you solve this specific issue? Well, it turns out that wealth is not evenly distributed. Wealth tends to go toward whiter people, and people who are of racial minorities tend to have higher poverty levels and worse health. And so this is not just a matter of throwing money, although that might work to some degree. If you took money from people who have more and gave it to those who had less, like Robin Hood, then this might solve the issue to some degree. But it's complex because some of the behaviors that we do, let's say you take somebody who is very poor and you give them lots of money, like they win the lottery. This doesn't necessarily going to improve their life a whole lot, or not necessarily going to improve their health behaviors, because we become accustomed to certain ways of life, our culture. Do you eat, fried okra, or do you eat fresh okra? When you have a family gathering, do you play cards and drink, or do you, I don't know, play charades? And just because somebody has more money doesn't necessarily mean that their pastimes are going to change there. So it's a complex subject that involves the customs and the attitudes about health and how much people believe their doctors and are you willing to change. Well, cultural competence is important. So if you are trying to convince somebody who is, say, not in the same culture that you are to change their health behaviors, it is helpful to understand them better. If you would imagine somebody who is from a different race or a different country or a different, maybe they're from New York City and they come to you and they say, hey, let me tell you, Jesse, how you could change your health behaviors. It'd be easy for me to look at them and say, you know what, you don't really understand like why I do what I do, or that, how I was raised and kind of the way we do life. And so I may not listen to them very much. And so if they had a little bit more cultural competence and they were able to understand where I'm coming from, or even able to have me articulate to them where I'm coming from, then that is going to help them be more effective in getting me to change my attitudes around things. Let's talk about morbidities, which are disorders and diseases. 1/3 of elderly people report that they are not able to do the activities that they used to do, and that this is because of a chronic condition. Men experience less chronic disease throughout their life. However, in their elderly years, they tend to get more deadly acute illnesses. Right? That's why this is likely why men are dying earlier than women. But women experience more physically limiting illnesses in their elderly years, but also throughout their lives. So the first thing to realize is that behaviors really do make a difference on someone's life, as do social factors. Social factors such as what amount of money do they have, or what neighborhood do they live in, or what kind of access to medical care do they have. Meaning it's not just genetics. It's not just, oh, I'm getting old, therefore there's nothing I can do to prevent these problems. No, the evidence is that there is quite a bit that people can do, or that the environment can do to kind of make their elderly years more healthy. Looking at the abuse and neglect of elderly persons, unfortunately, there has been a recent increase in the number of reports of elderly abuse. And this could be physical abuse, it could be sexual abuse, it could be emotional abuse, it could be financial abuse, it could be emotional abuse. And it is oftentimes coming from the elderly person's family that is taking care of them. It could be children, adult children. It could be relatives. It's not usually institutional. It's not usually the CNAs who are, say, working in the nursing home caring for the elderly person. But there are special laws that are created to protect elderly people more so than, say, the adult population, because the elderly people are more vulnerable than adults as a group. And so being aware of that and knowing the laws around that are important. So that is all that I have for chapter 6.